Hi there. My name is John Knight. I am a physical therapist with Altius Physical Therapy and Wellness here in Eagle, and we also have another location in Avon. Today we're gonna be talking about osteoporosis and osteopenia. Okay, so this is the third lecture in our Aging and Wellness series. Please go check out the other three: functional resiliency, balance and falls, and pain and arthritis. Okay, what is osteoporosis? So osteoporosis is progressive bone loss as we age, okay? Um, what you're seeing here is what your bone would look like underneath the microscope, okay? This pink stuff all the way on the outside, this is what the actual bone looks like, right? This is the bone matrix, okay? This is where we get the strength in our bones from, okay? And it's made up of these little cells here called osteocytes. In the matrix, we have blood vessels like this, okay? So they kind of weave themselves in, right? Bone actually has a very good blood supply to it, okay? And in those little blood vessels, we have these things called osteoclasts and osteoblasts with a B. Osteoblasts are responsible for depositing minerals into the bone matrix. So these bones help to lay down calcium and phosphate, the minerals that make the actual bone tissue nice and strong, okay? Conversely, these are osteoclasts. So these are the cells that are responsible for breaking down the bone tissue, right? So these, what they actually do too is they help to regulate the amount of calcium in your blood. So if the calcium in your blood is low, these guys will eat away at the bone tissue and then restore a balanced amount of calcium in your blood. But osteoclasts and osteoblasts work together to constantly change and remodel your bone structure, okay? And this only becomes a problem when osteoclasts, so the ones that chomp away at it, when they outperform osteoblasts, the ones that lay down bone tissue, okay? Let me come back to that in a second. And so what happens is if those osteoclasts outperform the osteoblasts, we get a bone that looks like this, okay? Really porous, right? On the left, we have a healthy bone, right? This is your femur. If I were to cut your femur in half, this is what it would look like in the inside, right? On the left, we have this really healthy bone, okay? It's really dense on the inside, okay? And on the right, we have a less dense or a more porous osteoporotic femur, okay? Meaning that it's got a lot of these little holes in it. It's a lot weaker than this guy is, okay? One way that we can stimulate osteoblast activity is through impact, okay? When we have impact, what this will do is it turns on those osteoblasts and they put down more bone minerals into the actual matrix itself, okay? When I'm just standing, if I'm just standing here, just like normal, okay, that means that my skeletal system is responsible for holding up 1 time my body weight, right? If I go for a walk and I take a step, that impact is about 1.2 times my body weight, okay? Compare that to a jump. If I were to go get really low, jump up really high, and land back down, like, stuff they do at like the NFL Combine and all that, that is 7 times my body weight, right? That's a lot more impact that my skeletal system has to absorb compared to walking. And this is why walking is a great exercise, but it's not a great tool for stimulating osteoblast and building up our bone strength, because this is only 1.2 times my body weight. I need more to actually get those osteoblasts to start working hard, okay? Let's go back to this slide here though. The two locations that we most oftentimes see a fracture at related to osteoporosis is at the femoral neck. So right here, this is right in your hip, okay, the side of your hip, the femoral neck, and then the thoracic spine. So right there in your mid back, okay. What'll happen is if I take a fall and I land on my side, this guy right here is the one that oftentimes gets hurt or gets fractured, right? So we see a lot of femoral neck fractures, okay? Also, too, what we'll see is, say I'm going skiing and I hit a bump and I get a jolt or something. Sometimes that can cause a fracture in the thoracic spine. So oftentimes they'll take a look there as well, okay? Osteoporosis can also lead to postural changes, okay? So changes in your posture, right? In a normal healthy person, this is what our spine looks like. But if the vertebral bodies, so these big discs right here on the front of your spine, if those guys get weak, over time, gravity will slowly push them together and into more flexion or forward bend like that, right? And if it gets bad, we can even see what we call a Dowager's hump here, where we get this rounded upper back because these vertebral bodies get so weak. And this is actually partially why we lose some of our height as we get older, right? Because gravity is slowly pushing and compressing those bones. And over time, that causes a loss of the actual height of your vertebral body. Okay. This is how we measure it. So if you're getting if somebody wants to take a look at your bone mineral density, they'll give you a DEXA. And so you lay on this big thing and it's an x-ray and we're measuring how much of the x-ray is absorbed in the bone itself. And this gives us what we call a T-score. So this is a measure of our bone mineral density. So if you get a DEXA, you'll get a little sheet with the impression on it, and it should give you a T-score here. And it'll give you a number anywhere from 0 up to the highest one that I've seen is like a 7, okay? And what those numbers relate to is standard deviations, okay? And this is a statistics term here, so bear with me. Right in the middle, imagine this is your whole population, okay? So everybody on the earth, right in the middle, this is your average bone mineral density, okay? So the majority of people, say 68% of the population is within 1 standard deviation away from the normal, okay? If I get a T-score of -1, that means that I am within 1 standard deviation away from the normal amount of bone mineral density, okay? If I continue to lose bone mineral density, I might get a score of -1.5 or -2, right? That means that I'm further than I am 1.5 standard deviations away, okay? If I get a score of -2, that means I am 68% decreased or have 68% less bone mineral density compared to the average, okay? And so in this way, this is how we classify the degree of osteoporosis. Osteopenia is classified as -1 to -2.5 standard deviations away, and any greater than 2.5 standard deviations away from the norm is considered osteoporosis, okay? So it's not black and white. It's not you either have it or you don't. There's a spectrum of how we classify this disease, okay? Let's talk about some of the factors relating to bone strength. So ultimately, we're trying to prevent a fracture down here, right? And if we can improve your bone strength, we can reduce the likelihood of a fracture, but a low bone strength is going to increase the likelihood of a fracture if you have a fall or something like that. The factors that contribute to low bone strength are age, right? As we get older, we know that we lose some of our bone mineral density. Genetics, diet plays a really important role too, right? Am I getting enough minerals like calcium and potassium in my diet to support my skeletal system? Lifestyle is really important. If I'm an active individual and I'm moving around a lot, say I do some exercise too, that can improve my bone strength. Hormonal status, we'll talk a little bit about this with menopause. That will impact your bone strength. Disease state and medication can also impact your bone strength, specifically steroids, okay? Steroids have been shown to inhibit osteoblast activity, so those bones that lay down, or I'm sorry, the cells that lay down bone tissue. And specifically, if you are on a steroid for longer than 3 months, that has a significant impact on your bone mineral density. So this is why doctors don't give you a cortisone shot every month or so. We have to wait for a long time or wait for at least 3 to 6 months in order to get another steroid injection as well, okay? Sarcopenia, or a loss of muscle mass, can also impact your bone strength. And then, like about to talk about, menopause and decreased levels of estrogen in your blood will also decrease your bone strength. Okay. And so, like I was just saying, this is unfortunately why women are at a higher risk of developing osteoporosis. First, like I was just saying, menopause. Estrogen is directly linked to bone health. Okay. As our estrogen levels decrease, this inhibits the ability for osteoblasts to lay down new bone tissue. Okay. And additionally, when osteoblast levels are low, this allows for osteoclasts to work, and then this speeds up bone resorption or destruction. Okay. Additionally, we found too that women on average lose bone minerals quicker than men. Okay. And the other thing too is that women start at a lower amount of bone mineral density on average compared to men. Okay. Not really sure. We don't have a great reason for why. Some people theorize that this can be related to that women sometimes will have a leaner body mass. Their skeleton's smaller on average. Hormones are very important, and then also calcium and vitamin D. But again, we don't have a really great reason for why women have a lower peak bone mineral density. So they already start, unfortunately, at a lower bone strength than men do on average. Additionally, women peak earlier than men do. So the rate or the start of the decline of our bone mineral density begins earlier in women than it does in men. Women typically peak at about 19 years old, and men typically have the highest bone mineral density at 22 years old. Okay. So we're starting lower. We peak earlier, or women peak earlier, and then the rate of decline is higher for women than it is for men. Okay. Let's talk about the good, the bad, and the ugly, right? Let's start with the bad stuff first. So the ugly is that if I have a fall and I were to fracture my hip, okay, so we talked about that femoral neck. If I fracture my femoral neck, on average, only 30 to 40% of people fully recover after an osteoporotic hip fracture. So this is why this is so scary and why hip fractures have to be taken so seriously, right? If you do have a hip fracture, we want to work with you a lot so that we can build up your strength, build up your activity levels, and then ultimately build back that bone strength, okay? The scariest statistic is the mortality rates 1 year after a hip fracture, okay? And they range from about 20 to 30%, okay? So mortality rate means the likelihood of death. So again, really scary, right? If you have a hip fracture, the likelihood of dying afterwards is as high as 20 to 30% 1 year after the fracture, right? So this is why we take this stuff so seriously and why prevention is so important, right? Let's just prevent this from happening altogether, okay? The bad, like I talked about, is that decreased estrogen levels increases bone resorption, okay? So this increases the rate that those osteoclasts are chewing away at the bone, okay? Like I talked about, steroid use, either an injection, like a cortisone injection, or an oral corticosteroid, that also causes increased bone resorption. And especially it becomes a problem if you're using an oral steroid longer than 3 months, okay? A lower BMI or body mass index, so think of like a smaller individual, pretty lean. Anything less than a 24 has been shown to be associated with an increased risk of osteoporosis as well, okay? The good thing though is that we can fight back against this stuff, right? What we know is that impact and shearing forces on the skeletal system are a really good way for us to stimulate those osteoblasts to do their job, right? So great news, right? They did a really big study. It's called the Lift More study, where for 8 months, they took a bunch of women with osteoporosis, or I'm sorry, not just women, but a population with osteoporosis. And they did high intensity resistance training. So they're lifting a bunch of really heavy weights. And what they found after 8 months was on average a 3% increase in their bone mineral density, okay? So not only were they able to prevent the decline of osteoporosis, they were able to build back more bone mineral density afterwards, right? That's huge. It's kind of a double whammy, right? We can prevent the decline and also build up our bone strength even further, right? They did also find too that machine training is just insufficient, right? So going and sitting on a knee extension machine, or doing a leg press, or doing one of those chest presses on the machine, that's not enough load through the skeletal system to actually stimulate increased bone mineral density. Okay, so we need to lift heavy weights. We need to stress the skeletal system to build back, that bone strength. Okay, this is the fun stuff too. This table here compares a couple different interventions or tools for tackling osteoporosis. Okay, on the top here we have heavy resistance training, and then we have medication, and then just doing nothing. If I do nothing, okay, and I'm a woman and I experience menopause, I can expect that within the first 10 years following menopause, that I'm going to lose roughly 2 to 4% of my bone mineral density every single year for 10 years. Okay. After 10 years, then we can expect an additional 1 to 2% loss of bone mineral density. So this is a really steep rate of decline, right? And this is what we want to prevent. Comparing these two, though, if I do some exercise and I do heavy resistance and I pick up heavy weights from the ground, deadlifts, squats, all that stuff, right? This can improve my bone mineral density on average 1 to 3% per year. Again, we're not just preventing this decline, we're building that bone strength back up again. Okay, so, and it might seem small, 1 to 3% might seem small, but if you increase your bone mineral density on average 2 to 4%, that's linked to a 50% reduction in fracture risk. Okay, so that small little number, 1 to 3%, can have a really large impact down the road. The most common type of medication that your doctor will give you to manage osteoporosis are bisphosphonates. Okay, and they've been shown to, on average, increase bone mineral density by 0.66 to 3% per year as well. And these are both good, right? These are comparable statistics, but I would argue that heavy resistance training is a lot more effective than that. And right at the end, I'll talk about a little bit why, but to give you a snapshot, not only are we improving your skeletal strength, right? We're improving your strength in your muscles, we're improving your aerobic health, we're improving your balance. And the other thing too is we're improving the architecture of your bones themselves. What I mean by that is this is the architecture, the inside of your bone here, right? There's a law called Wolff's Law that says that your bone will remodel depending on the stress that you put onto it, right? If I go do a bunch of squats all the time, this bone tissue, and I should go over here, this bone tissue will remodel in a specific way to handle those stresses. So the architecture, the inside of the bone here actually changes to absorb and better meet the demands that you're putting on it, right? So doing heavy resistance training will actually help to change the architecture inside your bones to better handle the stress. Okay. Let's see, where was I? Okay. So what are the exercises that we're talking about? What are some of these heavy resistance exercises that I was mentioning? The biggest two that I like to focus on are squats and deadlifts, right? With a squat, we're loading the spine. So we're stimulating that osteoblast activity at the spine. And with a deadlift too, we're doing the same thing, right? That's a lot of load going through our low back and in our hips as well, right? The other couple here, we've got power training, so quick high velocity movements, kettlebell swings, squat press, like going into a squat and then pushing up with the arms, doing like an overhead press. Okay, so quick movements that creates a pull on the bones where the tendon actually attaches to the bone, and that stimulates osteoblast activity as well. Okay, impact, like that table was talking about before too, that force going through your skeletal system when you jump and when you land, that stimulates bone remodeling as well. Okay, so jump squats, clap push-ups, stomps, stuff like that. And then balance training, right? This is the other part of fall prevention, right? If we can improve your balance and reduce your risk of falling, then that will reduce your risk of getting a hip fracture. Okay. I don't advocate for everybody to go lift 225 pounds like she's doing here, but I just put it in here because it is possible, and I'm sure she has really strong bones because of it. Okay, when we do resistance training, whether you're working with a physical therapist or you're working with a personal trainer, we need to be really specific with our exercise, right? Depending on what we're trying to improve on, say you get a DEXA on your hip, you have a low T score at your hip, let's do squats, let's do some lateral lunges, exercises that will specifically load the hip to create that remodeling, right? It needs to be specific to your needs, okay? Overload. If I were to do a bicep curl, say I did a 10-pound bicep curl, and that's all I did every day for 3 months, right? My arms aren't going to get bigger because I'm not overloading the tissue. I need to constantly keep increasing the weight to strain the tissue that we're targeting here, okay? So this is, again, why walking is insufficient, because every time I take a step, that's 1.2 times my body weight, right? And that weight is staying consistent all the time. Walking is a great exercise for countless other reasons, but if we're talking specifically about bone strength, we need to overload and we need to progressively increase the resistance on our skeletal system to get beneficial effects. Okay, you need to be consistent too, right? Again, if I were to go to the gym and I put on all this muscle and then I just stopped cold turkey, I would lose that muscle over time, right? Same with our bones. If I am not keeping up with heavy resistance training, over time, I'll revert back to losing on average 1 to 2% of my bone mineral density each year, right? So this is why we need to stay consistent to prevent that gradual loss, okay? And then the other thing too is switch it up, right? Our body reacts the best to change and trying new exercises here and there, because what that does, related to that Wolff's Law, is it changes the architecture inside our bones, right? Just doing the same exercise over and over again is going to mean that you're going to get really good at that exercise and your body will be able to tolerate it. But to continue to improve our bone strength, we need to do different exercises to challenge the skeletal system. Okay. So I've got 2 more slides here at the end. I would argue that a DEXA scan is an okay way to measure your bone strength, but it's not great. Okay, the DEXA does measure your bone mineral density, okay, but it does not measure the strength of your cortical bone. So on the outside here, this is our cortical bone, this white line on the outside. This is the outside of the bone. This guy's really strong, right? This provides a lot of strength and stability to the bone. On the inside is the trabecular bone, or trabeculae, the spongy portion, okay? A DEXA is just looking at your bone mineral density. It's not actually getting a good, accurate assessment of the strength of the cortical tissue here, okay? It does not look at how porous the inside of the trabeculae is here, okay? It also doesn't look at that microarchitecture right inside that I was talking about earlier. If I'm doing a bunch of squats all the time, my bone is going to adapt so that it can better handle the load of the squat, right? A DEXA is not going to assess the actual architecture and the makeup of the strength of your bones. And then we've got collagen changes, right? Too. Collagen's a really important component of our bone strength as well. And then also micro damage, right? If you've ever had like a stress fracture and they took an X-ray and they showed the X-ray showed a stress fracture, a DEXA is not going to work the same way. A DEXA will measure the amount of X-ray that's absorbed into the actual bone, but it won't be able to identify any sort of micro damage or a portion of your bone that's weaker than the other portion, okay? So a DEXA is a good starting point, but this is why resistance training, in my opinion, is much more effective than just taking a medication, right? Because resistance training will improve your cortical bone strength, It will also improve the microarchitecture, all of the guys in here that help to withstand the load that you're putting on it. So a medication will improve the bone mineral density itself, but it's not going to change the microarchitecture in here, and it's not going to really improve the strength of the cortical bone on the outside. Okay. With that being said, though, it is still a good idea to get a DEXA scan. On average, for your average individual, if you don't have any bone problems or osteoporosis already, on average, doctors recommend getting a DEXA every 15 years, okay? If you already have osteopenia or osteoporosis, you can cut that almost by a third, right? If you do have osteoporosis, though, I would recommend getting a DEXA at least once a year to keep an update on all that. So that's everything. Thank you very much. If you have any questions, feel free to give us a call or reach out. And these are all the citations and references. So thank you very much, and we'll see you in the next lecture. Take care.